He was so evil that Stephen King, the guy that writes some of the scariest horror books known to man, based one of his characters on her. Her name, Genene Jones, born July 13th, 1950, and was almost immediately given up for adoption because of how ugly she was. Okay, I'm sorry. That part's not true. She's just so horrible. Anyways, she was given up for adoption and was adopted by an upper middle class family. Her dad was an entrepreneur, a professional gambler. He even owned his own nightclub. Life was relatively pretty nice, at least until she turned 10 years old. That's when her father would be arrested for theft, leaving a lasting impact on Genene because for the first time in her life, she would have to know what it felt like to struggle. By the time she was in her 20s, she had already learned how to charm her way into powerful rooms, get cozy up with the right people to help move her up the chain. That's what helped her land the job at Bexar County Medical Center, which is now known as the University Hospital of San Antonio. She was super underqualified to work in the space in the ICU that she worked at in the pediatric division, which is usually filled with RNs, and she was only a vocational nurse. But because of who she knew and who knew her, she actually was able to get the job. Genene's shift would be from 3 to 11, also known as the death shift, because babies that were just fine always seemed to just code during that time. But Genene would save countless of babies' lives, receiving huge praise and recognition from her peers and the families. But because of the increase in the baby's coding, the hospital decided to close off that wing in the hospital, letting go of all their vocational nurses and only reserving it for the RNs. So that left Genene and a couple of the other nurses out with a job, but they wrote her and her coworkers an amazing reference letter. Due to that, she easily secured a job at the pediatric clinic run by Dr. Kathleen Holland, 60 miles northwest of San Antonio and Kernville. Yet mysterious illnesses and deaths seemed to follow Jones there. In about 31 days, 8 of the patients had 8 separate medical emergencies. Genene would be the reason why some of those babies lived, but what would raise concerns was when 15-month-old Chelsea McMillan died after a routine checkup. An investigation was immediately launched, interviewing everybody involved in Chelsea's care that day. You see, the doctors had actually suspected foul play because earlier that day, they found a puncture wound inside a newly diluted bottle of, and I'm going to butcher this name, succinylcholine. What that is essentially is an extreme muscle relaxer only used in medical emergencies that would paralyze a patient. Investigations would show that Chelsea would code soon after receiving shots from none other than Genene Jones. As they investigated her more, they would find out that in the 31 days that she worked there, she was involved in 8 medical emergencies. When they told her old employers at Bexar County Medical Center about what had just happened,